if you will. The conversation continues with my experts on the bench tonight, and it's all about coronavirus. Any questions you have, this is your moment to ask Dr. Koinange, AMREF Health Africa Group CEO. It's your time to ask the CAS for Health, Dr. Mercy Mwangangi, and Professor Omwanzala, a virologist at the University of Nairobi. This is your moment to ask your questions. It's about you and this virus. Folks, I have a question from Kennedy Otieno Atinda, who says, the primary symptoms of this dreaded virus is similar to that of the common cold. For instance, coughing, fever, sneezing, and so on. How can a person deep in Mashinani in the village get to know the difference between common cold and COVID-19? Dr. Gitahi.
You see, we are not attempting to convert rural folk and ordinary folk to clinicians so they can make the decision on whether it's common cold or COVID-19. So what we are saying is, of course, the symptoms may be similar, but we know as clinicians that there's a distinctive factor. Some of them may have, cough, high fever, which is why we test people for fever as they come in. But there's also the feature of difficulty in breathing, which is new because, as Professor said, it affects the lungs. So the clinicians know how to differentiate between the two. So basically what we are saying is, all of us, there's no treatment for panic. There's only treatment for good response and understanding. People need to know what to do. And that's why we've said the Ministry of Health has provided a hotline, 719. If you're worried, don't try to distinguish is this COVID or not. Call 719 and you'll get the necessary advice. And we are telling people also, don't rush to the facility. Okay, because when you have these symptoms, oh, I'm dying now, I'm going to go to the local facility, because I know there has been a bit of that confusion. So it's good for us to tell people to be calm, make the call, because if it happens to be COVID and you go to a clinic, then you're also putting the health workers in danger. So just stay where you are, make a call 719, you'll be guided, and if the person on the other side thinks the distinction is you need further guidance, they'll tell you exactly what to do, which includes being collected from where you are by the Ministry of Health specialists and be taken to a place where you can be tested if they think you really need that.
Speaking of testing, Dr. Mwangangi, Nelly Mwangeli on Twitter is asking, do we have enough testing kits countrywide?
So, Nelly, the thing is, we do not have enough kits the whole world, globally. There's a shortage of kits globally. And so what the Ministry of Health is doing is we are developing protocols with our experts to determine who should be tested and who should not be tested. And it's important for Kenyans to understand getting tested doesn't mean that you get better care. Exactly. Getting tested doesn't mean that then you get, a certain drug. In fact, this condition is much like the normal pneumonias that you see, and especially for critical cases, severe pneumonia. And so the management, how you treat this patient, is actually more or less a standard approach. And so testing and not testing is not really a factor in how we will take care of you. However, of course, because it's a new virus, testing brings about a need to study it and understand it better. So Kenyans should not panic about the tests. The issue here is not testing. The issue is that we are ready to be able to then manage you should you present with that pneumonia that is severe.
Yeah. Okay, Professor, unlike HIV, which you're an expert in, when you hear someone has tested positive for COVID-19, it's like, oh, wow. Oh, hopefully they'll survive. But if it's HIV, you're stigmatized right away. I don't know what I'm getting at here, but if Tom Hanks or Idris Elba or folks like that, people say, oh my goodness, or the basketball players.
We feel for them.
Yeah, you feel for them, but more often than not, you will survive. Yes?
Yes.
Exactly.
That's what I'm trying to get at.
The difference is that one, nobody survives. There's no recovery with HIV. By recovery, I mean is that once you're infected, as far as we know now in HIV, you are infected for life. Other than the 2 patients who have undergone bone marrow transplant, which is not a day-to-day kind of a management process. So HIV is one of those viruses we believe is latent and stays in you throughout, as opposed to coronavirus. The coronavirus, from what we have understood now from China and the other countries, 80% will recover. All right?
Yeah.
With maybe mild disease.
Can it come back?
Now,
Recur? Is that what you call it? Reoccur?
Sir,
now it's a difficult story. But let me finish this first.
Okay.
80% of those infected will recover with something between mild to moderate. Another maybe 15% will have maybe moderate to severe. And maybe those who will pass away will be maybe 2% or less. And now we know that age has a big factor to do with those who pass away. Now, the other story now comes that once you recover, can you be reinfected? That's what you're asking.
Yes.
Yes. Now, from the experience we had, there have been 2 outbreaks of coronaviruses. The first one was in 2002, called severe acute respiratory syndrome. SARS. The second one was MERS-CoV.
Yes.
Middle East respiratory syndrome.
Correct.
In 2013. All right? In all those, there was recovery. But there has been a few literature coming in to show that in SARS, people recovered, but in 6 months down the line, there was reinfection. Meaning that the immune response they generate is not long lasting. So here, those are the things that we want to understand, whether SARS-CoV-1, which was 2003, and SARS-CoV-2 are any similarities. Yeah, so that is still up in the air. But what we've known, there's been 2 or 3 reports from Japan, but there's a possibility of reinfection.
Okay.
Yes.
All right. Let's take another break, folks. We have to pay some bills, sorry. When we come back, your questions right here on Jeff Koinange. And I know there are many tweets are coming in so thick and fast to Jeff Koinange Live here at Citizen Television. We are taking your questions, your comments, anything to do with Corona. And I've got the experts, the panelists are right here on the bench. We've got a call, folks, from Abdul Latif in Mozambique, no less. Abdul Latif, if you can hear us, go ahead. Good evening. What's your question or comment?
Yes, Jeff. How are you? Are you okay, Jeff?
I'm very okay under the circumstances. Oops.
Yes.
Yeah, go ahead.
I am. Yes, and the question is, I'm asking Dr. Anzala. Is that Dr. Anzala, you said that the virus is on the ground. And then is it necessary that we use masks daily on our daily basis? How would you advise us?
Okay, usage of masks, because you say the virus could be on any surface for up to a day. Why use of masks, he asks?
Yes, the use of mask is because if you come into contact with somebody with the signs and symptoms we've suggested, and is a suspect, we call a suspected case, then during the discussion, when we talk, there are aerosols that we generate. And depending on how close you are, you can easily inhale those aerosols and get infected.
Okay.
And hence the use of
Masks.
That's why we insist on using masks, especially the frontline health workers, where a patient comes into casualty, they are exhibiting those signs, they are talking to you. Put on a mask. Also tell them to do what? To put on a mask.
Dr. Kisari, if someone coughs in a matatu, coughs or sneezes, is that a cause for alarm?
No, it's not, because I think, people cough, they sneeze all the time. But obviously what we are saying is that when you cough, to avoid this infection, we have now advised people, don't cough into your hands because we don't know what you got. Cough into your elbow. That's the advice across. Therefore, any aerosols that may go then are stopped, and the people in the matatu are not in any danger. That's what we advise. So
cough into your elbow.
Into your elbow.
Exactly.
Exactly.
We call
or
it
cough into a tissue, and then when you get to a place, dispose the tissue. Don't cough openly, don't cough into your hands.
Exactly.
Oh.
Exactly.
Dr. Ari?
And important to note, you can actually also transmit this through improper use of a mask. So remember, even if you have the mask, it's protecting you. But if you come into contact, who coughs, near you, the aerosols are deposited on the outside surface of the mask. So these masks are single use, and they're a specific kind of masks. And because, again, they're in short supply across the world, we're recommending that the masks are, one, prioritized for our healthcare workers. the people who are our heroes on the front line, working and trying to protect us and trying to manage those who are unwell.
Yeah.
And two, for carers of people who may be in quarantine, in their houses and self-quarantine, we do advise the use of a mask, and it is single use. And how you put it on is also part of a technique. And there are videos that we'll soon be sharing in how to properly put on a mask, how to take it off, and how to dispose of it.
Yeah.
And
so
when-
in short, because I think it's very good to be very clear. We are not advising people to use masks.
Exactly.
I think it's very good to be clear about that.
Okay.
Unless you meet that criteria, Dr. has talked about. You are caring for somebody who is vulnerable, you are a healthcare worker, and you're immediate risk. Do not go and buy a mask and walk around with them in town. They're not helping you. If you're not sick and you're cough, then it doesn't help anyone. So don't use masks.
Okay, real quick, Dr. On that note, you have sanitizer in your pocket. Mashinani, there's no sanitizer.
Yeah.
Sanitizer as opposed to washing hands with soap.
You made
Talk
a
to me.
really good point, and that's why I didn't put my sanitizer here. It's in my pocket. The only reason I have a sanitizer is I may be in a place where there is no water and soap, and therefore I need to wash my hands. Let's say I'm in the community or I'm somewhere on the road, or and I need to sanitize. But it is an alternative to hand washing with soap and water, running water. Don't wash inside a basket like this, which is why we advise people. Today I saw a matatu, and I think where they have actually hung a jerrycan of water on the back with a tap and with soap on the side. That's perfect. That's innovation. So people need to find solutions where they are. And therefore, what you need to do is get somebody to pour the water for you on the hands, or old times used to use the licketing, and the villages still use the licketing, where you take a jerrycan, hang it on a tree, put a small hole with a matchstick, and put soap on the side. So when you need to wash your hands, just wash and then put back the matchstick. It's as simple as that. When you say running water, we are not saying water from a tap, because we know many Kenyans don't have access to water from a tap. So running water, soap is priority. Sanitizer only if you cannot find running water. And we have sanitizers in many of the businesses.
Professor.
And not this way you are given a bucket and you wash like that.
Exactly.
No.
Exactly.
No. Not that one.
No.
You've seen that?
No.
Yun ile ya ugali.
Running water.
Exactly.
Running with soap.
Yes.
Any soap works.
Yes.
Kipanga soap works.
Any soap
Right.
works.
We're not talking about antibacterial soaps here.
No.
Anything that has saponification effects works.
And let me say something.
Go on.
Sorry, because it's important. We haven't spent enough time talking about disinfecting of surfaces. Because that's where that's what Professor has said. Touching. Let's take a guy. I was in Kibera yesterday, and I went to a shop. This guy sees over 60 customers a day, and they have this surface where they interact. They come. The use of bleach. Just taking bleach, chlorine-based bleach. We don't mention brands here.
Okay, good.
But you can mention. There are some that are almost synonymous with bleach.
Yes.
And I found they're actually available in this size. Not only the big one, very tiny like this, which is like 15 shillings. Then you mix that with water. So that small one can take maybe up to 2 liters. Then you just keep disinfecting the surfaces. That is a very good solution, which then makes sure all the surfaces are clean. And it kills the viruses, kills the bacteria. We haven't talked enough about that.
And it's simple. I mean, it's basic.
Basic.
It's basic.
Yeah.
You can even put it in a bottle where you can spray.
You can spray.
On the surfaces and wipe.
And just wipe.
Yeah, every so often.
Yeah.
Folks, questions. Let me go to the wall over here. Sorry to jump up like this, but the questions are coming in thick and fast. Mercy Mora says, for persons with pre-existing conditions or low immunity, how life-threatening is it for them if they get coronavirus? Anybody?
I think that is now the real problem we are getting at, because those are the ones we call individuals with comorbidities, pre-existing conditions, diabetes, hypertension, heart disease, maybe people with malnutrition. And basically it's because of what you also said, issues to do with age. Their organs are not functioning at
100%.
100%.
It's the opportunistic thing that I was talking about earlier.
Exactly.
As Professor Koinange.
So the clinical outcome,
Right.
you have got it.
Right.
So the clinical outcome
Yes.
is likely to be more moderate to severe.
But not to paint gloom for these people.
Right.
Remember, in Kenya, we have a large hypertensive community.
Correct.
We have people who are diabetic.
Diabetic,
So
yes.
what should they do? Diabetics, make sure you're managing your sugars.
Exactly.
Yes.
If you're hypertensive, make sure you're taking your drugs. If you're immunocompromised, if you have HIV, make sure you're getting your drugs.
Yeah.
Protect yourself. Do the things that the doctors are telling you to do to protect yourself. And that gives you a better chance.
Dr. Kisai, Nduthi riders.
Yes.
Nduthi,
Yeah.
spare helmet, worn by a few dozen people a day.
Right.
How do you disinfect a helmet?
You disinfect a helmet exactly the way we said. We don't want to advise people go look for sanitizer.
No.
Just take a small bottle of water that you normally have, mix the chlorine-based bleach, okay, like JKLive, let me just say it, okay? Mix it with water, a little of it, a lot of water, and you can do probably 1 volume of that to about 4 volumes of water. Then keep it. Just slot it somewhere on your. So after every passenger,
Drop off, yes.
Take off, wipe inside, wipe outside, wipe the handles where they touched as well, not just the helmet. Yesterday I was teaching matatu drivers and taxi drivers to wipe the handles where their customers hold on to get into the matatu, where they are holding when they are sitting. And and also remember cash transfers, okay? Yeah. Remember that when you're exchanging notes and you're buying money with notes, the notes can actually, there's a surface they can hold by. So that's why we're encouraging people use digital money and less of. And if you have to use notes, then sanitize your hands or wash your hands immediately with soap and water. But this is really the responsibility. We don't want people to panic. We want people to know that this is in their hands. Yeah. Now the question around people who are compromised, this is where also individually you need to make a decision that because I am more vulnerable than other people, I will observe social distance more carefully than other people. It's a personal decision.
Exactly.
That's what we are saying.
We've got Robert from Marsabit County calling. Robert, if you can hear us, good evening. What is your question?
My question, Jeff, is can COVID-19 have a relapse level? Can it relapse?
Is that a relapse level? Is that what it is? Relapse? Is what he said?
Relapse.
We talked about that earlier.
Yeah,
Robert, just listen. We talked about it earlier, but Professor, you go ahead.
Yeah, by relapse, there are 2 ways we look at relapse in science. Maybe you recover, but the virus never really went away.
Sure, it's later.
Yeah. So you actually it comes back again. Mm-hmm. Okay, there's a word I wanted to use, but I'm not going to use. You told me to tone down.
No, let me hear this clinical word. Impress me.
He's in college.
I'm an honorary professor now.
So talk to the professor.
Okay? Because we call it recrudescence. It has not really gone down. All right?
Yes.
But then, unless he's talking about a reinfection,
right,
where you have completely recovered,
and then
you've gone back to the community, and then you get reinfected.
Yep.
And then that's what we said from SARS. That occurred in 2002, there was an element of reinfection, but 6 to 7 months later, showing that the immunity was waning over a period of time.
Okay. Right. Dr. Mercy, I'm going to let you have the last one before we take a quick break. Kenya, where we are right now, were we late in the game? Are we on course? Are we staying the course?
Kenya is staying the course. Kenya is actually being celebrated. Our president is being celebrated for being decisive, for instituting measures urgently, for being very expeditious. So we are on course, and I want people to get comforted. We are well seized of this issue, and the president is on high alert with his team, and we are on course. We just need to work together and adopt a whole of society approach and collective responsibility as Kenyans.
And I want to confirm that because people can say she is government, therefore she is complimenting her boss and that kind of thing. He's also in government, University of Nairobi. But I am independent. Kenya has actually taken very good steps, very early and very decisive.
As opposed to Italy, which was late in the game. Let's face it.
Exactly.
Let's face it. Italy was late in the game, and they have paid the price.
They have paid the price. And I want to thank the churches that have actually taken the bold step to say we are observing the instructions, the courage, and we are going to stop church services this Sunday. I really want to congratulate them.
And the Muslims as well.
And the Muslims as well. And the Muslims as well.
We are very impressed.
Yeah.
Let's take a break. Come back. So much more. Your questions are just coming in so thick and fast. Keep calling. 0719 777 SMS number 222 and of course your tweets still coming in thick and fast. We'll read them all when we come back right here on Jeff Koinange Live. We'll take a break. We'll be back in a moment.